Functional movement screen was designed as a pre-participation injury screening tool that focuses on the identification of compensatory movement patterns that are suggestive of increased injury risk and reduction of functional performance. The 7 components of the functional movement screen are the deep squat, the hurdle step, the inline lunge, the active straight leg raise, the functional shoulder mobility test, and the rotary stability test. We're going to go through each test and explain how to perform each test accurately, how to score the test accurately, as well as how to point out some compensations that we might see in our patients. Starting with the deep squat, we're going to instruct our patient to stand tall with the feet approximately shoulder width apart and the toes pointing relatively forward. They're then going to grasp the dowel in both hands and place it horizontally on the top of the head so the shoulders and elbows are at 90 degrees. The participant will then press the dowel directly above the head, as you see here. Now, while maintaining an upright torso, we're going to instruct the participant to descend as deep as possible into a squat, holding the bottom position for a count of 1, then returning to the starting position. Now, before we look at my squat here, it's important to point out the FMS scoring system. Now, with the FMS, the scoring system uses a scale from 0 to 3, 0 being the worst possible score and 3 being the best possible score. The FMS system judges based on quality of movement and or the presence of pain. So with the deep squat, a score of 3 is achieved when the upper torso is parallel with the tibias vertical at the bottom of the squat. Femurs must be below horizontal, so below 90 degrees, and the dowel and knees must be aligned over the foot throughout the entirety of the movement. So let's take a look at my squat here. Let's see if we can score it accurately. So as looking at the anterior view, as I come down, you can see that my torso really starts to collapse forward there, and it collapses forward. And this will be better visualized at the lateral angle, which I'll show you in a second. So coming over at the lateral angle, we're able to see here as I come down, my torso really starts to collapse. So at this moment when we see this, a score of 3 is unable to be achieved. So looking at our tibias here, they're not quite vertical. They start to carry forward a little bit. And also my femurs are able to get to about 90 degrees, but we'd like to see it a little bit below that. So again, looking here, torso not upright, shins aren't quite vertical, and also as you can see, the ankle mobility here is not great. So as you can see here, ankle starts to come off the ground. So could be from a lack of mobility, could be a lack of stability. It's hard to tell until we put our feet up on the box, which we're going to do now. So the next part of the test, we're going to instruct our participant to put their heels up on the box to achieve a little bit more stability, a little bit more of a posterior weight shift, and also a little bit more room for our ankles to move. So looking at the lateral view, with their heels up on the box, I'm able to achieve a much more upright torso. As you can see here, looks great. The dowel is right up above the head, which is a really good thing to see there. And also, the ankle mobility improves vastly. So, looking at this, we're able to score this test as a 2, since putting my heels up on the box corrected the movement pattern. So let's look at it from an anterior angle where we're able to see some compensations that won't affect the score, but are important to note here. So one more time, looking at this squat from a forward angle. So as you can see here, there's definitely a right weight shift. We call that a list to the right. It's important to note for your notes, just to know that this participant displays a right weight shift. A lot of the pressure is being put into the right leg there. Also, as we can see, the right knee and femur, as well as the lower leg, are internally rotated a bit more than the left one, as we can see here. So that's just something to note, although it doesn't affect our score. And we return to the starting position. So that is the deep squat. Next, we're going to look at the hurdle step test. So the setup for this one is a little bit different. So we're going to stand tall with the feet and toes touching the test kit. We're going to grasp the dowel with both hands and place it behind your neck, across the shoulders, and while maintaining an upright posture, we're going to raise the leg and step over the hurdle, making sure to raise the foot towards the shin and maintain foot alignment with the ankle, knee, and hip. We're going to touch the floor with the heel and return to the starting position while maintaining foot alignment with the ankle, knee, and hip. So for the scoring system, for a score of 3, we're looking for the hips, knees, and ankles to remain aligned in the sagittal plane. We're looking for little to no movement in the lumbar spine, and we're also looking to see if the dowel and hurdle remain parallel. So let's look at mine here from the anterior view. So, as I start to come forward with my right here, you can see little to no movement, although there is a little bit of movement in the frontal plane at the hip right here, as you can see. So probably not a 3, but it's pretty close. So I would say from an anterior view, this is probably a 2 here from the right. As we can see, foot stability remains in line. So looking at the other foot, we see a little bit more of a wobble here, and also, again, right there, you see more of that weight shift in the frontal plane. So also kind of unable to tap my heel down here, kind of do more of my forefoot. And as I return, so from an anterior view, we would say that's a 2, but as we look at the lateral view in the next clip, we'll start to see a little bit more going on that you might not notice from the anterior view. Alright, so looking from the lateral view, this is why it's important to look from multiple angles to notice different things that are occurring during the test. So like we said during the scoring criteria, we're looking for our lumbar spine to have little to no movement during the test. We're looking for all the mobility to be coming from the hip as well as a little bit from the knee as we're bending. So as we go forward, as you can see, I kind of dump my back into a lot of extension in order to achieve the movement here. So as you can see right here, difficult to see because of the shirt, but there's a lot of extension occurring at the lumbar spine, and that's not what we want to see with the test. So as I return, you can see, looking at the other foot, again, here we go, and this one's even worse, and I also dump in the frontal plane, which is difficult to see, but we saw it in the last clip. But as we can see, starting over, extension there, and even more extension there, and a little bit more unevenness. So looking at that, we would not score that a 3. We would score that one as a 2, as alignment was lost between the hips, knees, and ankles, and there was some movement noted in the lumbar spine, and the dowel and hurdle didn't quite remain parallel throughout the test. For a 1 there, if a score of 1 would be noted if contact occurs between the foot and the hurdle, which wasn't noted, and if the 1 would be scored if there was a loss of balance noted, which didn't happen. So looking at that, we wouldn't score it a 3, we wouldn't score it a 1, so we're looking at a 2. Alright, so next we're going to look at the inline lunge. So set up for the inline lunge, we want to place the dowel along the spine so it touches the back of the head, the upper back, and the middle of the buttocks. While grasping the dowel, right now our left hand should be against the back of the head, and the right hand should be against the lower back, and that's with the right foot forward and the left foot back. So we're going to step onto the box, a 2x6 box with the flat right foot and the left toe on the 0 marker. Now the right heel for me is going to be at the 18 centimeter mark because that was the measurement for my tibial tuberosity height. So both toes must be pointing forward with flat feet, maintaining an upright posture so the dowel stays in contact with the head, upper back, and top of the buttocks. We're going to descend into a lunge position so the right knee touches the 2x6. The left knee touches the 2x6 behind the right heel. Then we're going to return to the starting position and score the test. So for scoring criteria for a score of 3, we're looking for the dowel contact to be maintained through 3 points of contact throughout the entirety of the movement. We're looking for the dowel and torso to remain vertical. We're looking for no torso movement in the frontal plane, and we're looking for the dowel and feet to remain aligned in the sagittal plane. Also, we're looking for that knee to touch down behind the heel of the front foot. So let's take a look at my inline lunge. So, looking in slow motion, as I start to come down, it looks good. It looks good until at the bottom Boom, right there. My right hip dumps out into the frontal plane, basically showing us that there's a lack of stability there. So as you can see, torso does not remain vertically aligned throughout the test. Looking at other parts here, my knee does touch down behind my toe. I am able to maintain points of contact throughout the entirety of the movement, and my torso does remain upright, although there is a little bit of forward flexion occurring. So as you can see me return to the starting position, looks okay as I return to the sagittal plane. So we would score that a 2 with the right foot forward. Now let's take a look when I put the left foot forward. So again, slow motion. As you can see, here I start to come down, remain vertically aligned, no frontal movement displayed, and I return to the starting position. Very fluid movement, so that we would consider that a 3 with the left foot forward and a 2 with the right foot forward. One thing you can be nitpicky about, as you can see here, my entire foot's not on the board and it's a little bit inverted, but that's not enough to call this a 2. So for me, this is a score of 3 for the FMS. Alright, so now we're going to take a look at the active straight leg raise test. So looking at the starting position, we're going to lay flat with the back of the knees against the 2x6 with toes pointing up. So this one we're observing my left leg and scoring the left straight leg raise. So we're going to pull the toes towards the shins, maintaining full dorsiflexion, and with the right leg remaining straight, and then the right knee pressing against the 2x4 or 2x6 box, we're going to raise the left leg as high as we can. So looking at the scoring criteria, a score of 3 is a vertical line of the malleolus residing between mid-thigh and ASIS, and the non-moving limb remains in neutral position. So as you can see here, we placed the knob there between the ASIS and joint line, and that gives us a marker to see if we can achieve a 3. So for a score of 2, we're looking for that vertical line to reside between mid-thigh and joint line, so anywhere in that region. And then for a score of 1, the vertical line of the malleolus would reside below the joint line, so anything below the knee there. So let's see how I did. So as you can see there, we'll go back. As I start to come up, extremely limited, and the line for the malleolus is below the joint line for sure. So as you can see there, that would be a score of 1. So not a lot of mobility noted. Could be due to a stability pattern as we start to look at all the components of the functional movement screen now. Alright, so next we're going to look at the shoulder mobility test as we start to look at our upper body patterns. So we're going to stand tall with our feet together and our arms hanging comfortably. We're going to make a fist so that fingers are around thumbs, and in one motion we're going to place one fist over the head, down the back as far as possible, while simultaneously moving the other fist up the back as far as possible. So here we're looking at functional internal and external rotation. We also want to instruct our patients not to creep hands closer after the initial placement. So looking for the scoring criteria, for a 3, we're looking for our fists to come within one hand length together. And we're also going to measure the hand length from the base of the palm to the end of the second digit. And that will determine hand length. For me, it was 7. Score of 2, fists are within 1.5 hand lengths, and a score of 1, fists are not within 1.5 hand lengths. So let's take a look at how I did.
Yep.
So starting here with the right hand forward into external rotation, and the left hand coming into internal rotation. As I come back, these are within are within 7, so this would actually be a score of 3. And I'm going to measure that.
Do I do the same one? Yeah, 2 more times.
A few more times, as you can see. It was 4 inches apart there.
Like 3.
And here, as we look again, this is a score of 1. So there's a lot going on here with my right shoulder and also my left shoulder. So absolutely no internal rotation observed here at the right shoulder. And the left shoulder is also lacking some external rotation here. But the big thing to point out is the lack of internal rotation. So that would be a score of 1, since they do not come between 1.5 hand lengths.
You're like 10.5.
Alright, so the next test we're going to look at is the trunk stability push-up. And while this may seem like a simple test since it's just a push-up, it tells us a lot about the body's overall ability to maintain rigidity through a movement, which tells us a lot about core strength and stability. Also, for setup for this one, we're going to lie face down with arms extended overhead and shoulders and hands shoulder width apart. We're then going to pull the thumbs down in line for men with the forehead and for women with the chin. So as you can see here, my hands are in line with my forehead. So then with legs together, we're going to pull the toes towards the shins and lift knees and elbows off the ground. While maintaining a rigid torso, we're going to push our body into one unit into a push-up position. So scoring criteria for this, for a 3, we're going to see if the body can lift as a singular unit with no lag in the spine. So let's take a look at how I do.
This is weird. Can I go like this? Yeah.
So as I come up, you can see there, my body comes up as a singular unit with no lag in the spine. Now, as you can see, before I initiate this movement, I do bring my hands down a little bit. So at this point, they may not be directly in line with my forehead. So this was an inaccurate setup of the test. So I would need to bring my hands up just a little bit, because right now, since I moved them down, my hands are not quite in line with my forehead. So we'd like to see the hands up a little bit higher. So this might have been error in scoring. So for this test, you would be unable to give it a 3. So I would give this test a 2. So for the last test and possibly the most difficult, we're going to look at rotary stability. So for the setup, we're going to get our hands and our knees over the 2x6 so that hands are under the shoulders and knees under the hips. The thumbs, knees, and toes must maintain contact on both sides of the 2x6, and toes must be pulled up towards the shin. At that time, we're going to reach right hand forward and right leg backward as if you were flying. Then, without touching down, you're going to touch the right elbow down to the right knee directly over the 2x6, return to the extended position, return to the start position, and then test the other side. So looking at scoring criteria for this, for a score of 3, if you can perform a correct unilateral repetition, which is extremely rare, you're going to score that a 3. If you're unable to complete a correct unilateral repetition, you will then perform a diagonal repetition with one arm extending and the opposite arm, the contralateral leg, will be extending at the same time, as if you're doing a bird dog. So let's see how I do here.
All right, go ahead.
So as I begin to bring my right hand and right knee back, I'm definitely unable to perform that. So unable to score a 3 there. But as I bring my right arm forward and my left leg back, you can see I'm able to achieve correct position, extend out, and extend out there, and bring the arms in, and extend out again. So right there, we're looking at a score of a 2. Now I'm going to switch and do the left side. So as you can see, again, unable to complete that repetition, but as I do the contralateral, I'm able to complete that. So we'd like to score that a 2. Let's look at it from a side angle here.
Left side.
So again, the left side, a little bit better, but still obviously not able to complete that. But that way, I'm able to achieve that. So looking at the right arm forward here and left leg back. Again, that was unable, but right arm forward, left leg back. Minimal lumbar movement observed, so we would like to score that as a 2. And that is it for all the tests for the functional movement screen. Again, the functional movement screen is a great way to identify compensation patterns, also where a participant may be lacking. Usually it has to do a lot with core stability. So this kind of tells us what we need to work on with each of our participants if they're lacking in certain areas. For me, my worst test was the ones on the shoulder mobility test, as well as the active straight leg raise test. So looking at how I compensated there, whether it's a mobility or stability pattern, this gives us a better idea of how we can properly use corrective exercise to improve these scores. So thank you very much, and goodbye.